So first, let me ask, what motivated you to take up this fight against hepatitis?
Okay, about 10 years ago, I was getting sick on and off. So I went to see my doctor, Dr. Kwame. Then he asked me to do series of tests. And when I was getting my results, I realized that the hepatitis B test was very expensive. It was 40 Ghana. So I started questioning that, what is this hepatitis? Why is the test so expensive? And I am the artist of the year and I find it difficult to pay this 40 Ghana. How about the unsuspecting woman selling yams by the roadside, to feed their children? And how would they hear? So with myself and him and another doctor, Dr. Kwesiapia, we formed an NGO called OK Foundation. And we started going out there to research about hepatitis, to screen and to begin to activate awareness about hepatitis. So the motivation was because the screening was too expensive, and so I thought of the everyday woman especially, and then I decided to use my resources to screen for free.
Okay, you've been doing this for 10 years.
Yes.
Would you say we're winning the fight against hepatitis, or we're not?
We are not losing and we are not winning. At least let me just say that we have been able to keep the prevalence rate at a place where it's not going up, it's not aggravating. So when we started 10 years ago, the prevalence rate was 15% for WHO. Said that 1 out of every 6 Ghanaians is exposed to the virus. And now it's still between around 10 to 13, 14%, depending on the social class of the person, depending on the place, depending on availability of awareness and things like that. So we are not winning, we are not losing. The awareness that we are creating has been able to peg the prevalence rate around 10 to 14%, and I believe that is good, seeing as we have very little resources.
Okay. In talking about resources, I was coming to that. How have you been able to sustain this campaign for the last 10 years, looking at how difficult sometimes sponsorship is to come by?
So basically, for the last 10 years, my major partner, he used to be my sponsor and then he became my partner, is MDS Lancet Laboratory. So I remember that I had done this hepatitis thing for 4 years, and then for 3 years I was giving up. So I said in the media that I'm going to give up because I don't have partners. And then I got a call from the CEO of MDS and I said, henceforth, I'm going to screen, give you the highest quality of screening, so that you'll be able to sustain what you are doing. So from that time till date, MDS Lancet, they come with a group of about 20 lab professionals. They set up under a tent and they test the blood and they screen for free. So I would say that MDS Lancet has been my biggest partner. And then apart from that, MTN Ghana Foundation used to also do it for about 3 years, and then they stopped. But yes, they are also with me. But for the vaccination and the paying of the nurses, it's not a pay, it's a per diem, the renting of the tents, the generators, the organization, the paying the media, all that has been coming from my pocket. So every year I see it as my responsibility towards Mother Ghana to also buy vaccines and create awareness to celebrate the day so that people would know. So okay. Yes.
Apart from the screening, do you give out medication to those who are already infected? Do you give out vaccines?
Okay, so we screen for about 4 or 5 years, the screen alone. And then we realized that the 85% of the people that test negative, they drift back into the risk zone. So then we decided to add vaccination. So once we screen you and you test negative, we give you free vaccination, because we believe that it is not very good to screen someone and tell the person you are negative and let the person go back home and get infected. So we give the free vaccination apart from the screening. This is how the screening goes. We do a pre-test counseling, which has a doctor that speaks the local language of where we are to explain the disease, how you get it, what happens, So we get a doctor to do the pre-test counseling. That doctor will explain the disease, how you get it, why you shouldn't get it, medication, all that. And then when we are done, we will ask the people to voluntarily allow us to take their blood samples if they wish to know their status. Then we will take it. And then once we are giving them the report, if it's negative, we let them go and take the vaccination. If it's positive, we get a doctor to talk to them about the statistics of the people who test positive, because only 5% of the people who test positive will actually develop it into an actual disease, so we have an actual doctor or sometimes a clinical psychologist to talk to them about these things. And then every time we do it with Ghana Health Services. So when for example, we are going to Tema, we are going to partner with a hospital close to where we are doing it, so that there will be a doctor who knows about hepatitis treatment, who knows about viral load, a doctor who can actually give you subsequent counseling, for you to change your lifestyle, or for you to get medication or get more testing. So we get beyond what we do with the World Hepatitis Day, is that to drum it home that hepatitis B especially is preventable. So get tested and get vaccinated or see a doctor.
Okay. You've been doing this, for 10 years now. Which age bracket would you say is most at risk, or which age bracket has the most prevalence?
The easiest way to get hepatitis is from mother to child.
Okay.
And because of that, even though I am a musician and I look at the youth, because people who are already 60-something years old, not to say that they don't need the vaccine, they're already old, So I am more concerned about the youth and children, So the children are the ones who are most at risk. So I would say between the day you are born until say 40, because, or I would say the age bracket, it cuts across. Only that we target from the day of birth till a certain age that we think that you'll be able to save yourself if we give you the vaccination. But the most important vaccines should go for babies whose mothers are hepatitis positive, hepatitis B positive, so that immediately they are giving birth to, they get the shot, so that they will not get the disease at all. Okay. Yes.
Okay, so this year, where are you doing it?
So this year we are going to Tema. Okay. We are going to be setting up 28th of July happens to be on a Sunday, and we don't think that we'll get the people on Sunday, so we are doing it rather on Friday. Okay. And we are going to set up in front of the Tema Metropolitan Assembly, where the taxi drivers near the market, so that place already has traction. So we are going to set up. The time we are going to start is at 9. We start early at 9 and close when it's getting dark, because we won't have lights, so people should come early.
Okay. And how has the response been? Do people cooperate with you when you go and do the screenings?
Yes, so I remember when we started, we had gone to Takoradi for the screen. We were screening at the market circle, and then some people came, and at that time I was young, so I had this shining rims. I was driving this big car with shining rims, and then one of the guys said, "Hey, what one rims? So those are some of the challenges. People didn't believe that it was a public health awareness creation, and what a musician and a rapper, what is his relationship to hepatitis, and what is his relationship to health and things like that. Another form of challenge that we had was that when we started, because we're just driven by passion, we just go to say Techiman and start screening people, and when we are done, we just leave the people who test positive to go home. We will not refer them to any. So it got to a point that Ghana Health Services got agitated, because it wasn't just me. Almost most of the NGOs who were driven by passion were just doing the same thing, so they had to come and do the policy guideline of what to do. So these are some of the challenges. Some of the challenges are some years that I don't have the money to spend on it. I must still find it, and sponsorship is difficult, because now everybody's crying, and if you've not had money to eat and go to the hospital, you are not interested in supporting a social cause, so these are some of the other challenges. Sometimes too, it is difficult to find young people, especially when we go to the universities. Young people they don't want to come for the screening. Why? Because of the stigma that hepatitis B especially spread through sex, which is not very true. Exactly. And they, because of the stigma that once you get an STD, you are being promiscuous, because of the stigma that it is an STD. So things like, so last year our whole campaign was stop the stigma, you know. So and I think that it has helped. But usually we want more young people to come out and test, because once hepatitis B especially is preventable. Once you know your status, it is safe for you. And even if you test positive and you are a part of the 5%, knowing it earlier will help you. Maybe sometimes when you talk to your doctor will tell you that you don't need any medication, you just need lifestyle changes, stay away from alcohol, exercise, eat the right diet, and things like that.
Okay. How has government support been for your campaign?
For my campaign, I would say that Ghana Health Services, they've been very supportive. And when I say supportive, it's not in terms of money. They've assisted us whenever we write our letters. They partner with us. They give us nurses. The Public Health Service Department will bring someone to come and speak at the event. And a week before the event, they give us video and audio vibes to alert people for us to play in the media. But in terms of money, no. I wish that even if it's not me, I wish that the Ministry of Health will have a budget for hepatitis, World Hepatitis Day celebration. I wish that the Ministry of Health will put out a statement about World Hepatitis Day celebration. I wish that the Ministry of Health will bring people together. You will bring the NGOs and people in research and the labs will bring us together and get us to have a plan, just as the same way we have a policy document, to have a plan that actually shows tactics of how we are going to achieve eliminating hepatitis by 2030.